Well, we're back here talking about eyes and everything to do with it. Dr. Planty, are there, eyes allergies, and which type of allergies are there which are very, often, which occur often? Run down some of them and tell us what choices we have to better that situation.
Well, allergies is an individual sort of thing. It's like kids growing up. Some people have food allergies. Some people are allergic to plants. Some people are allergic to cats. And any of those antigens that are out there can get in the eye and create an irritation that the system doesn't like for one reason or another. The biggest symptom to the patient that they have an ocular allergy is, number one, the eye is red, and number two is it itches. Itching seems to be associated with allergies as opposed to, say, a dry eye that doesn't itch. It feels kind of gritty and sandy and irritated at that point. So the biggest thing is red and itch at that point. And again, identifying the source of the antigen is probably the number one thing that you can do. That's the questions that we ask when we get a patient in there. We try to go through, did you spray something in your eye? Were you out mowing the grass? Were you in the woods? Were you in a chemical plant? Were you around bleach? Were you around fumes? To try to identify what created the situation. Once we identify that, well, number one, you stay away from that and you don't put that stuff near your eyes, and you can help out there. But if it's like plants or grasses or cats or things like that, there are medicines out there that are anti-itch medicines that will eliminate a lot of the discomfort from the allergies at that particular point. So we want to identify the allergen, number one, and then we can kind of initiate treatment, number two, to kind of take care of a lot of the symptoms, the itchiness, the redness, the burning, the redness at that particular point with medicines that are prescribable. Unfortunately for allergies, there's no over-the-counter allergy medicines that will help you out at that particular point.
Okay, so basically medicine drops, things like that to kind of get rid of it, and just basically identifying what it is. And I didn't
Absolutely.
know that.
And, if you can't get in to see an eye doctor to figure out what's going on, number one, if you realize that you've got something in your eye, whether it's grass or fumes from cleaning solutions or paint thinners or whatever, cool water to rinse out your eyes just to kind of quiet things down, and you put cold on it. Cold will kind of help quiet everything down at that particular point so that you don't get it so that it's itchy and swollen and irritated.
Okay. All right, wonderful. Well, I didn't know that allergies most of the time or all the time are not, they're itchy, and I didn't realize that dry eyes are not itchy. When I see these television commercials, I always immediately associate with people having itchy eyes, but apparently not, huh?
Well, see, that's the danger of commercials on TV that say, get the red out, use Visine, use this, use that. You got to kind of sort of identify what created the redness in the first place. If it's an eye infection in the cornea, you're going to get a red eye. If it's an allergy, you're going to get a red eye. If it's a dry eye situation, you're going to get a red eye. I mean, we've got to determine what's creating the redness in there. You just don't want to start throwing stuff in your eyes to get the red out because you're not taking care of the problem that created the redness in the first place.
Right.
Come see us. We'll take care of you.
I think that's very obviously the solution. Go to people who have studied that subject for decades and, literally for a decade in school, and then usually somebody like you for decades thereafter. Why reinvent the wheel, damn it? I mean, for something so important like your eyesight or anything in your body for that
exactly.
matter. You know what I'm saying?
Exactly. A lot of people don't pay attention to what their body's telling them at that particular point in time. If your knees are hurting and there's pain, you need to go to a knee doctor. If your shoulder's hurting, you need to go to a shoulder doctor. If you just answer the questions of what's going on with your body, I'm sure it's going to cost a little bit, but that little cost for preventative medicine is going to be far less expensive than initiating any kind of surgeries or treatments at that particular point.
Besides, Mr. Obama is going to pay for it all anyway in the future, right?
I don't want to go there, but hopefully somebody's going to pay for it.
All right. Bye-bye, Dr. Planty.